In the U.S., there are roughly 250 million adults. About 133 million of them have at least one chronic disease, and about half of those people are dealing with multiple chronic conditions.
Well, for the first time in more than 20 years, the life expectancy for Americans is declining.
We can save lives. As much as 80% of heart disease and stroke-related deaths can be prevented with education and action.
I think the problem with healthcare in the U.S. right now is we focus so much on treatment and so little on prevention, and that's where the Affordable Care Act has really failed. I think if we focus on prevention of disease, we can better educate our patients and make sure that we eat better. 1 in 3 kids is obese right now, so we've got to set better examples for our children.
2 Princeton University economists identified rising death rates in white, middle-aged Americans, driven largely by increases in deaths from suicide, drug overdoses, alcohol abuse, and chronic liver diseases. And when I read that, all I see there is sadness. Like, those are diseases, that's when you're sad. There's something more going on than just you're eating badly.
Depression rates among young adults and teens are on the rise. Researchers analyzed drug use and health data for teens and young adults and found that episodes of depression increased in adolescents from nearly 9% in 2005 to just over 11% in 2014. Now, the greatest increase was found among teenage girls. Experts say more research needs to be done to determine why this group is affected more, but think cyberbullying and negative texting experiences may play a role.
One of the real paradoxes explored in the triple bind is girls, compared to 15 or 20 years ago, are depressed ever earlier, are actively attempting suicide at much higher rates than a decade ago, are committing acts of self-mutilation and self-harm much more frequently, are binge eating at all-time highs, and at the same time are fighting and getting into violent behaviors much more than they used to, and even more than boys who are actually decreasing. The mental health problems we're talking about don't, unfortunately, seem to be time limited to adolescence. Once they get triggered in adolescence, these can portend a lifetime of problems.
1 in 5 Australians will suffer from depression. That's frightening, but it's just a statistic. The truth is, you can't really understand what it means unless you've actually had depression or watch someone you love struggling with this terrible illness. It can be a private, lonely pain. After all, there's still a stigma attached to any kind of mental illness.
When we look at the leading cancers, we predict that the greatest increase in the number of new cases will be for prostate cancer in men and breast cancer in women. Cancers of the lung and bronchus and colon and rectum will also increase, but the increases will be not as great. We predict that we will continue to see increases in new cancer cases and cancer deaths each year.
All right, and finally this evening, very sad news to bring you. Michelle Farnsworth, who was a focal point of a high five in November, passed away yesterday afternoon. Michelle was a sophomore at Nashoba Regional High School. She was a member of the field hockey and swim team. See her right in the center of the picture right there with the hoodie on, holding the trophy. She couldn't play this year because of daily chemo and radiation treatment. She passed away yesterday afternoon. She was 15 years old.
Obesity costs this country about $150 billion a year, or almost 10% of the national medical budget. Approximately 1 in 3 adults and 1 in 6 children are obese. Obesity is epidemic in the United States and a major cause of death attributable to heart disease, cancer, and diabetes.
We have 2 million kids who are morbidly obese. Most of them are undiagnosed with prediabetes or diabetes, and the study showed that drugs don't work. That we're going to have to put kids on insulin, which is a disaster. So we need a different solution. This is really a social problem. We need a social cure, and we're not going to solve this in the doctor's office. We have to solve this in the communities where people live. We have to change things like access to sodas and school access to good food.
But add insulin.
No, insulin actually creates a slippery slope.
No. Go ahead.
Insulin is a slippery slope. This study recommended starting insulin earlier, which doesn't make any sense. It causes rapid increases in weight. It increases cholesterol, blood pressure. We need a different solution.
So the way you plan it out, it sounds fairly easy. You cut down on the soda, you start to eat better, you exercise more. But yet we know all of those things.
That's right.
And clearly it's not working.
No, it's not working because, the average kid has 34 teaspoons of sugar a day. We have 54 gallons of soda. These things are shown to be addictive, and the food industry has hijacked our brain chemistry, our taste buds, our homes, our kitchens, our schools. We need to take them back, and we need to do things like have soda taxes. We need to do things like change food marketing practice to kids, because This is not a problem that's solved in the doctor's office.
Those are some pretty hot topics.
They are hot topics.
Well, a patient getting the wrong medicine, a surgeon operating on the wrong body part. Medical mistakes are more common than you think, and according to a new study by Johns Hopkins researchers, those mistakes are now the third leading cause of death. Dr. McCary, these are stunning numbers, the third leading cause of death in the U.S.?
Well, you know, John, the medical profession has matured in the scientific study of patient safety to recognize that people don't just die from bacteria and cancer, they also die from medical care having gone wrong.
SSRIs have been linked to causing suicidal thoughts and serious birth defects. The FDA warns patients that taking Prozac in combination with the antibacterial agent linezolid can cause serious central nervous system toxicity. Eli Lilly and Company has paid millions to victims across the nation for their injuries caused by the company's drug Prozac.
The Eli Lilly Corporation, a pharmaceutical company, for nearly 15 years covered up their own internal investigation that showed that anyone on Prozac is 12 times more likely to attempt suicide.
Johnson & Johnson is being ordered to pay a record $417 million over claims a Los Angeles woman developed ovarian cancer from its baby powder. And the company is facing thousands of similar cases right now. It's the largest award yet in lawsuits alleging the company failed to adequately warn its customers about the cancer risk of its talc-based products. According to the American Cancer Society, many studies have been done on a possible link between talc and ovarian cancer, but the results have been mixed.
A CDC scientist and an author of the study in the journal Pediatrics that insisted there is no link between vaccines and autism admits that he and other authors of that study left out information that was deemed controversial.
We've gone back and we looked at the evidence, and what I can tell you is we intend to come out with an announcement by the end of this year.
We sued FDA to compel them to respond to our petitions after waiting very patiently for 5-6 years. And they did so. In January of 2015, they came out with a document that completely affirmed what FDA had found in 2009, which was that mercury fillings are completely safe. We, my team, IAOMT, we were all deeply disappointed. And then we get this whistleblower document. It was a document that provided prohibitions on placing mercury fillings in tens of millions of people. What happened here? What happened? HHS came back and provided a political solution to a thorny scientific problem. HHS put the veto on this statement of policy that would have been published by FDA, but for HHS's political decision, not scientific, political decision, to not change the way the game was played. But don't be deceived, there are hundreds of peer-reviewed, published scientific studies by top authors that associate the mercury in fillings with systemic disease.
If amalgam is taken to a Class 3 by the FDA, Class 3 would require manufacturers to prove safety, which they never had to do. They're not going to spend the millions of dollars to try to prove that mercury is safe when everyone knows it isn't.
The FDA's whole system of drug review is bogus. It's designed to protect and advance the interests of the drug industry. A lot of people don't realize this, but FDA never tests the drugs it approves. FDA does no independent testing at all. It relies entirely on the testing done by the drug advocate, the proponent of the drug application that has a self-interest and a conflict of interest. That party is looked to for all of the drug testing. In fact, Sanofi Aventis, with its drug Keytech, relied principally on a clinical trial that FDA's medical reviewers, who are sharp on the case, discovered didn't even happen. And there were FBI investigations and prosecutions. But what did the FDA do? The medical reviewers said to the commissioner, gee, they relied on a fraud for this application. We should deny it. But the FDA commissioner granted it. So you see, it's that degree of influence and corruption that makes it impossible for the American people to be protected.
Well, it coats the pots you cook with so the food doesn't stick. It protects the carpet your baby crawls on. You may also have it in your winter jacket, your skin lotion, even your makeup. We're talking about Teflon. And tonight, a 2020 investigation uncovers alarming information about this much-used material.
Teflon, the famed non-stick surface on pots and pans. In a different form, used to keep stains off carpets and clothing. What DuPont calls the housewife's best friend.
Cooking without Teflon just isn't any fun.
A $2 billion a year business, all based on chemicals. But the unexpected discovery of the almost universal contamination of human blood from the Teflon chemical called C8, combined with worrisome laboratory studies, has now led to a high-priority federal investigation of the chemical's risks.
Now, what's so interesting about this particular case are the documents that have come out of it. We know now that it took 53 years from the time the company classified C8 as a toxin to the time they stopped dumping it in the Ohio River. And this isn't something that was done a long time ago. In the year 2014 is when they finally stopped dumping this chemical into the Ohio River. And at that time, they had known for almost 20 years that exposure to this chemical caused cancer.
New at 5:30, two major corporations have agreed to nearly $700 million settlement in water contamination, a case that was investigated by Local 12 News. Last year, we told you how a chemical known as PFOA was discharged into the Ohio River by the DuPont Chemical Company in Parkersburg, West Virginia. An independent science panel linked that chemical to 6 diseases, including testicular and kidney cancer.
So far, 280 people have been arrested under what they're calling Operation Polluted. That is across 4 states, Arkansas, Louisiana, Mississippi, and Alabama. 140 of those arrests came in Arkansas, including 4 doctors, 4 nurses, and 5 pharmacists. Authorities today made it clear that more arrests could still be coming.
We are not targeting the medical community. Most people, particularly teens. We are targeting the drug dealers that are hiding amongst you, because that's what these doctors and pharmacists are. They are drug dealers.
Here's a scary fact. In 2014, 47,000 Americans died from drug overdose. That's a new record. But if you peel back the numbers, many of these Americans are not dying from illegal drugs. The main killer is not cocaine, meth, or heroin. Instead, totally legal opiate painkillers were the biggest cause of overdoses. How did we get to this point?
6 former executives and managers from Arizona-based drug maker Insys Therapeutics face conspiracy charges over what a federal prosecutor calls a racketeering scheme. Investigators say they bribed doctors to prescribe the company's pain medication even when it wasn't necessary.
It was a crime that came to light as 7 Action News investigator Heather Catala worked to expose how many sex offenders are able to keep their licenses as healthcare professionals. Despite the fact he was convicted of sexually assaulting and beating a patient in 2001, Dr. Donald Quinn was working at Southfield Dental Care and hadn't told authorities. A short time after our coverage, police arrested Dr. Quinn for failing to share his work address for the sex offender registry.
And a funeral is being held this morning in Florida for Rebecca Sedgwick. The 6th grader committed suicide last week. Authorities say she suffered nearly a year of cyberbullying. As Michelle Miller reports, more than a dozen of her classmates could be held responsible.
A 16-year-old girl dies in a weekend car accident when she's thrown from the vehicle.
The driver of the other car, a woman arrested for driving under the influence, but police say it was the car the teen was riding in that ran a red light.
Kids in high school are actually talking about using heroin and like bragging about it like they, drank a few beers last night.
I'm addicted to heroin.
I'm just going to die from this because, number one, I can't ask for help. I'll lose my medical license.